Hi, so my name's Dr. Zaki Hussain, and I'm the CEO of and founder of Touch Lab Limited. So Touch Lab is a company based in the UK, actually in Scotland, and we manufacture electronic skin for robots. So we make skin for robots that is actually thinner than human skin to give them a human sense of touch. Currently, robots can't feel things very well, and in order to be able to do precision tasks, they need to be able to feel touch in the same way as humans feel. So we've been trying to solve this challenge. And here you can see a robot that's really designed for a medical setting. It can feel, it has a very good sensation of touch through the fingertips. It can even feel slippage or if something is about to slip. And we see this really useful in the medical setting. So for using robots to take care of people, but also for clinicians or healthcare practitioners to actually remote work. So you can be using this robot from home, and you can actually be helping a patient in a hospital. One of the things that we really designed the robot to solve is catheterization tasks, or actually tasks that require maybe inserting a needle or a tube somewhere in the human body, and they need to be done very precisely, and it's very important to feel the touch through this. So we've made this system that allows you to feel precise touch to be able to do very many medical tasks. In the future, we hope that this will allow doctors or even nurses to work remotely. And right now you will have surgical robots where surgeons can work remotely, but actually it's much harder to have a nursing robot or a robot that can do a lot of different tasks, not just a single surgery. So that is really what we're trying to do here with so we're demonstrating here a haptic teleoperation device. So it's actually an avatar system where you can control the arms and the hands, even the fingertips of the robot, to be able to do very precise, dexterous tasks. And the unique aspect is that we're mapping the haptics from the fingertips of the robot to the fingertips of the operator in this case. What we're really interested in is doing medical tasks. So actually being able to help nurses in a hospital and help doctors do tasks like catheterization, tasks that require a lot of precision and dexterity. And in order to do that, you have to be able to feel a good sense of touch at the fingertips and also potentially the rest of the hand later.
We are the Italian Institute of Technology, and at Yروs we are happy to have brought two robots. One, the ErgoCab, which basically means a robot, a humanoid robot for ergonomics, and the other one, the IronCab, which is the only flying humanoid robot, jet-powered, that exists in the world. So while we were developing the robots, the main questions were basically two. The first one was how can we develop a humanoid robot that can help future workers in warehouses? Actually, if you look at the current situation of the health of the workforce, you understand that the current musculoskeletal apparatus is having some problems for this workforce. So we want collaborators that can help workers. And this was the main reason why we developed the ErgoCab, which is the white robot just behind me. Then the other reason for developing the IronCab, which is the red robot behind me, was disaster response. So we wanted a platform that could operate remotely, like overcoming floods, fire, landing, looking for survivor, and then moving from one building to another one. That's why we started working on flying humanoid robots. So these two robots represent the uniqueness of the Italian Institute of Technologies concerning humanoid robotics for several aspects. Just to mention a few, the ErgoCab is completely autonomous, and this autonomy is achieved thanks to our teleoperation system. And the IronCab, which is the flight version, is clearly unique. It's clearly unique because it's unique by its nature. So now we are moving forward to develop further these two platforms, and we are trying to understand how to industrialize them. So basically the exercise here is to transform the robot, which is a prototype, into a product. And now we are trying to understand how to get along in this direction.